My name is Lakin, and today I'll be presenting on Ondansetron, which is also known for the trade name Zofran. Zofran is classified as an antiemetic, and it works by blocking serotonin receptors, specifically the 5-HT3 receptors found in the vagal nerve terminals and in the chemoreceptor trigger zone of the brain. By blocking these receptors, it prevents the neurotransmitter serotonin from initiating the nausea and vomiting reflex. This makes it useful in conditions where serotonin levels surge, such as during chemo, radiation therapy, or in post-operative settings. Clinically, the dosage is both effective and safe for controlling moderate to severe nausea. Some of the most common side effects include headache, dizziness, constipation, or diarrhea. While these are generally not severe, they can cause the patient to feel uncomfortable. Some more serious side effects include a QT prolongation on the ECG, which carries risks of dangerous arrhythmias, serotonin syndrome, and which is possible if the patient is receiving other serotogenic medication. When I was preparing to administer this medication, there were several different categories of nursing thinking I focused on. First was dose time. I would carefully check when the last dose had been given, so I knew that they would not exceed the maximum daily limit. Next was assessment, and before giving this medication, I asked the patient to describe the severity of their nausea and had them rated on a scale of 0 to 10. I also would review their medical history and recent labs, looking for risk factors like cardiac conditions, electrolyte imbalances, such as low potassium and magnesium, or concurrent medical conditions that could increase that risk for QT prolongation. During the evaluation process, which was another key factor, I would look to reassess my patients 30 to 45 minutes after, and then I would provide them with some explanation and ask them for another nausea score, which would allow me to compare like before and after treatment. I'm thinking they would report improvement in their symptoms, and I would also monitor them for dizziness when ambulating, since the CNS effects like headache and lightheadedness can occur. In doing this, patient education is a very important aspect of giving this medication, especially because nausea can be an ongoing and recurring issue during recovery. I also take the time to explain to the patients why they are receiving the medication, and I emphasize that this medication works best when taken early before the nausea worsens, so it's important to communicate with the nurses if they're feeling anything. And I also let the patient know that although the medication is effective, it can also cause like headache and constipation. So if they notice any changes in their bowel habits, they should notify us right away so that we can adjust their diet, fluid intake, or add any stool softeners if needed. I also encourage my patients to report any dizziness so that we can take full precaution when they're ambulating after surgery. I explain that the simple language of serious reactions will be palpable chest discomfort, which may point to heart rhythm changes, or unusual symptoms like muscle stiffness or confusion that can happen if they're on other serotogenic medication. I would encourage my patients to alert staff quickly if something is wrong and also communicate if they have any questions. When I was thinking about preventing medication errors, 3 of the most important areas I focused on were documentation issues, the MAR not being referenced, and monitoring issues. For documentation, I knew that if I didn't chart the Zofran right away, another nurse could have thought that dose hadn't been given and could repeat that medication, which would cause a double dose. To prevent this, I would document the medication immediately in the MAR after leaving the patient's room, and that kept on record up to date and reduced the chance of that duplicate dosing. Next, with the MAR itself, I would make sure not to rely on memory when preparing the medication, and if I had skipped the MAR, there was a risk of giving an outdated order or the wrong dose. Instead, I would pull up the medication directly on the MAR and follow the 3 med checks, along with doing that at the bedside. Finally, monitoring another major safety step, since ondansetron can cause QT prolongation and other complications, I would review my patient's vital signs and check their cardiac history and look for recent labs, again, like I mentioned about the potassium and magnesium, which could give them a higher risk for those arrhythmias. I would also reassess symptoms like dizziness and nausea after the administration. By addressing these three areas, documentation, MAR reference, and monitoring, I think that would reduce the likelihood of medication errors and keep my patient safe during the administration process. For future growth, there are several action plans that I would want to take. And first, I will be more intentional about checking the MAR 3 different times: when I pull the medication, when I prepare it, and right before administering to the patient. This just reinforces that three check process and make sure that I'm consistently verifying the right patient, right medication, right dose, right route, right time. Second, I will make it a priority to document immediately after I give a medication. By charting right away, I can prevent another nurse from accidentally giving the same drug, and I can ensure that the MAR is always up to date. We always get super busy running here to take care of people, so making it really tactical to chart that right after could be a big future goal of mine. And third, I'll focus more on patient teaching, really emphasizing that they should notify me of headaches, dizziness, constipation, palpitations, signs of serotonin syndrome. These actions will help me build consistency, develop stronger habits, and ultimately, which is the most important, keeping my patients safe during administration and building that trust and connection with my patients.